I know you like talking about feet. I've seen all your videos. I'm Doc Faisal, orthopedic surgeon with Move Smarter Health. We are sponsored by an educational grant from Kinesi Movement. I love sports. I love talking about injuries. I take care of shoulder and knee injuries, and I operate and treat on them. And please consider this an educational, informative video only. Here we go. Lane Johnson, right tackle, Philadelphia Eagles. He's out. Why is it important? Because his quarterback sucks when he's out. So that's why we're going to talk about it. What happened? All right. So we don't have the details of the specific injury. Apparently it's a sprain. He may need surgery. We don't know all the details, but it was the Lisfranc. So what's the Lisfranc joint? Well, first talk about what happened. We don't know. So did he land like this? Did he land like that? Did he twist around in that sort of attempted block? Or we don't know. So regardless, what is the Lisfranc injury? That's a foot. That's your skeleton. There's the, am I pointing to it correctly? Yeah, there's the Lisfranc joint. So it is the second tarsal metatarsal joint. And that is actually considered the keystone of the foot. So keystone, we all know this. Can you put a keystone there? Like there's one keystone, it holds up the arch, right? Well, that's what this is. This is the keystone. It kind of holds everything together. And if you have an injury, do you go divergently or together, homologous? So does it go together? Does it go separately? Is it divergent? Is it completely destroyed? Like this is sticking up or down or out. You basically can disrupt this joint. So it's increased space. Sorry, I'm hiding. Increase space there, increase space there. You could have a fracture dislocation. You could have a dislocation. You could have a subluxation. You could have a sprain. Now, Lisfranc injuries are important. They can be significant. If you have a fracture dislocation of a Lisfranc that requires surgery, that's a significant injury that is likely to put you out of season. However, that's not apparently the case. Again, disclaimer, I am not the treating surgeon. I have not seen his images. I'm not involved in his care. This is an educational video contextually about Lisfranc, using this athlete as an example of the injury so we can get some contextual awareness. So the reason for the stability is based on the shape. It does have an arch. Okay, so if you were to actually look here, see there's an arch. That's the keystone of the arch. It provides you stability in multiple angles. Look at the way that's second tarsal and metatarsal. See how it's locked into there? And so that's important. And so when you get an injury of that, it can actually cause significant instability in the entire foot. And when you actually test for it, we can't do it here because these bones will just bend, but you can actually do a stress view. So it wouldn't actually bend there. It would actually separate there. And you can do a stress view going like this or a stress view like that. And that gives you, and you can even do it up and down. And I've seen the Lisfranc fracture dislocation in all sorts of directions. I mean, I don't treat that anymore, but certainly during training and early part of my career, I saw plenty and treated plenty of these, just some of the worst Lisfranc fracture dislocations and just dislocations and subluxations. Some of them require just a screw, one or two. Some of them require reconstruction. Now we have all sorts of little tether bands and methods with synthetic fibers to actually stabilize across the joint. The screw being the gold standard. Sometimes if you have a bad fracture dislocation, do you need bone graft? Do you not need bone graft? Did it affect the blood supply? There's all sorts of really interesting information about the Lisfranc joint. Why is it called Lisfranc? Because there was a Dr. Lisfranc who coined the term for that joint as being significant, and now it's called the Lisfranc joint. Anything you would like to know, Joey?
If they have surgery on a sprain,
Yeah.
What kind of a sprain?
Yeah, so sprain is such a broad term. It can mean anything, right? Like, did you tear any fibers? Were there micro tears? Did you just stretch it? Well, what is stretch? Stretch is a micro tear because are the fibers intact? Well, they look intact. Well, what if I put an electron microscope down? Are they intact? Well, is it a micro tear? Well, what is a tear? What is a sprain? What is an injury? What is a strain? What is a sprain? What's the difference? Okay. So typically what happens is that you can get sprains and strains, and the significance of a sprain occurs when you have instability. So dynamic instability. So it may look intact, meaning on an x-ray with multiple views, you get oblique views, angled views, Lisfranc views, and then you also get stress views of the ankle, weight bearing, non-weight bearing, and then you can do all sorts of stuff. Manually under fluoro, oftentimes you put these special lead gloves on and you grab the foot and you move it in certain directions and try and see if it's stable or unstable. Now, you can't always do that with a significant injury because it hurts. Let me say that again. It can hurt. So you have to be careful. Some patients are able to tolerate it. Sometimes you have to put a bit of lidocaine in the area. Sometimes you actually have to put the patient to sleep to get true instability testing under fluoroscopy to really see how unstable it is. Now, if it is unstable, then what is the grade of instability? And that can then determine, well, okay, maybe we can put it in a special orthotic boot, shoe boot, some type of a cast to stabilize it, see how it heals, and then check the stability. Or you can go all out and say, okay, there's significant instability. He needs to get back in the game. Let's put a screw or whatever type of fixation implant the surgeon that's treating him decides, and then make a determination on his recovery and rehab and whether or not he can get back into the game for the playoffs. If they even make the playoffs. Oh no.
Wrong team. They'll make it.
No, but you know someone's going to put a comment down there. I know. They'll make the playoffs. But here's the thing. How are they going to do without him? What's the next 6 weeks, 4 weeks? What's it going to look like? What if he has surgery? Is he going to be out? We don't know. Stay tuned. That sounds like I'm a cartoon.
Saturday morning.
I am a cartoon. I should be a cartoon. Can you just cartoon my face? Just make it all cartoonish. Yeah, let's do that.
Cool if I could do that.
Yeah. Well, there are like these.
Work on that.
Yeah, that would actually be kind of cool. Just sort of switch me to a cartoon, and then I'll say I want a cup holder there, and there, right? And no one's going to understand that either because it's like no one watches cartoons. You guys, like if you're less than 20 years old, you have no idea what I'm talking about. It's okay. Youth.
Does him being a gigantic human being, is that going to affect the speed of his, because he's like 6'4", 300 pounds going up against other guys that are 6'4", 300 pounds, and there's so much pressure on the foot.
Yeah, so the amazing thing about the human body is that it adapts. I mean, these are super athletes that are super large already. I mean, they're putting how many foot-pounds of torque and how much pressure and how many newtons of direct force are being applied to that leg. Like when you land, you're taking 300 pounds, you're landing and jumping, and he hasn't injured it before, and then this time he did. Is it a cumulative trauma? Is it a repetitive strain? Is it something that happened from one injury? Like it wasn't like a big bad injury where he suddenly got his foot crushed or trampled on or twisted, right? It was like, oh. So maybe it was cumulative trauma. We don't know the answer to that, but what we do know is that the body can adapt. That's how these players can play. I mean, if you work on lifting and moving and doing all these activities, your body knows this is how much weight, this is how much force, this is what I can do and build upon. Now, obviously there are limits and constraints because when you beat up your body like that over what's the average career span of someone who plays a position like him? Maybe 10 years at the most, right? For that amount of force. And then you see these athletes afterwards and they have degenerative joint changes. So there are limits to what you can do, but your body adapts and adjusts to it and tries to accommodate for it. So even in the healing process, when he stops weight bearing on that joint and on that foot, the first thing that happens is your body just basically says, oh, hey, this foot is not being used. Let's demineralize the bone. Oh, we don't need this muscle. Cause it to atrophy. That's why your muscles get weaker. It's partly because you're not using it. If you don't use it, you lose it. It's like the classic gym philosophy. But in the body's case, it actually matters. It does happen. And that's why you don't want to go from like lose weight too quickly, because what happens if you have a sudden decline in your weight, your body depletes the mineral because saying, oh, hey, I can make hollow skeletons because I'm not carrying this weight anymore. It can actually cause and predispose to injury if you have sudden shifts in your body. We've seen that happen plenty of times. In this particular case, more likely than not, he's going to maintain the body, the strength, and the weight for the most part. He'll have the intrinsic muscles will really need a lot of work after this injury. I mean, we're talking about the interosseous muscles and even the small intrinsic, extrinsic muscles, and the entire foot muscle, foot and ankle kinematics. Because, Charles, welcome back. What happens here? If I try and position myself here, what's happening? What's engaging? I heard someone in the back say it. Hamstrings affecting the tibia. Calf muscles going from the femur all the way down to the Achilles, all the way down. You've got the tibialis posterior helping with the arch underneath the foot. You've got all the perineals. You've got all the intrinsics. Your entire axial, appendicular, pelvic girdle connection, the entire body can get affected, even with weakness and an injury in your ankle. We see it all the time. Work injuries, sports injuries, life injuries, recovering from a minor sprain to an ankle fracture to a hip fracture. The entire human body kinematics can get affected. And that's why it's important to quantify the whole body and really understand what the kinematics are. And you know, sometimes I know you guys get frustrated in healthcare because we're very siloed in how we treat patients. And it's frustrating. It's frustrating to me. It's frustrating to you guys how we get siloed. It's like, oh, I need to see the foot and ankle guy, the knee guy. Well, that makes sense for specialized care. But then you still need to sort of step back and say, hey, how am I moving relative to that injury? How is my overall proprioception and balance when I move? I see it all the time. There was a super athlete recently that I saw, and I could clearly see that there's an imbalance there, and it turned out he had an injury previously to a toe, and that affected how he walked and mobilized and his entire kinematic balance. I could visually see, and then when we did a couple of tests, I could literally see that in the clinic. So from that standpoint, there are many things that we can identify that can be affected from minor injuries or major injuries. And the major injuries like come out at you like boom, like a dart, right? It's like, okay, that's obvious. I broke my leg, therefore it affected my whole body. But what about ankle sprains? What about foot sprains? What about Lisfranc sprains? What about minor things that you inadvertently may favor, and then all of a sudden, 20 years from now, you find yourself limping, even 5 years from now, maybe after his injury, maybe when he returns back to play, he's favoring that limb. We've talked about this before. What is his overall limb, knee, ankle, foot symmetry and joint health? And how does it connect to the entire body for his overall mobility kinematic balance? We still have this entire black hole of data that's gorgeous and wonderful that we don't even know. We're not even looking at it, but we are with Kinesi. So ultimately, for someone like him who's a super athlete, he's got trainers, coaches, doctors, therapists. You know, he's got the cold plunge pool. He's got all the fancy gadgets and bells and whistles and injections that, most of us can never use, including myself, right? So that access is incredible. So they're going to work on him. They're going to get him healthy and get him back. But the point of what I said earlier was even a minor injury can affect your overall kinematic balance, and that's why it's important. Then absolutely. Could it predispose him to another injury? It could, because there's also the kinematic balance and confidence, but it starts up here. Do you have that confidence back? And even if you do, you're like, I'm back in the game, I'm gonna work and I'm gonna play and I'm gonna push through it. And you may have stiffness and you may push through it, but at some point that can affect you. And sometimes it's subtle, sometimes it's not. Now, I don't want to paint a grim picture, but I think if we're talking about the limited understanding of what we have sometimes, even in the immediate injury to short, medium, long-term consequences of injuries, because we sometimes have siloed information, absolutely. There can be short and long-term consequences. However, the good thing is that it's called a sprain. We don't know if he's going to have surgery, so let's hoping he comes back and the Eagles have a great playoff season. Even if they're not my team. Uh-oh.
And as long as they don't play the Niners.
And as long as they don't play the Niners. But what about the Ravens?